Assalamu alaikum. This is Afaf Al-Anazi from course Problem Teaching in Nursing College, supervised by Dr. Alfat. Our lecture it's literacy in adult client population. So at the end of this presentation, all of us, inshallah, we will be able to define various terms related to literacy and health literacy, identify the magnitude of the literacy problem, describe the characteristic of those individuals at risk for having difficulty with reading and comprehension of written and oral language, discuss common myth and assumption about people with illiteracy, assess the impact of illiteracy and low literacy on patient motivation and compliance with healthcare regimens, recognize the role of the nurse as educator, and assessment of a client literacy skill, outline various teaching strategies useful in education client with low literacy skill. So let's go. As we know, nurses are in a unique position that enable them to act and advocate for and empower each client to obtain, understand, and act on information provided to them. By focusing on health literacy issue and working together, nurses can improve the accessibility, quality, and safety of healthcare provider, reduce cost and improve the health and the quality of life for millions of people. So there is here many definitions of the terms. Literacy, what we mean about literacy, it's ability of adult to read, write, and comprehend information at the 8th grade level or above. Illiteracy, it's the ability of adult to read, write, and comprehend information at the 4th grade level or below, or not at all. So, low literacy, it's ability of adult to read, write, and comprehend information between 5th to 8th grade level of difficulty. Health literacy, it's the ability to read, interpret, and comprehend health information to maintain optimal wellness. Functional illiteracy, it's mean in adult the lack of fundamental reading, written, and comprehension skill needed to operate effectively in today's society. So readability, it's the ease with which it's written or printed information can be read. Comprehension, it's the degree to which individual understand and accurately interpret what they have read. So scope and incident of the problems. Literacy is a silent epidemic, silent barrier, a silent disability. So in national adult health literacy report specifically found that it's 36%, 47 million of adults had basic or below basic health literacy. Older adults 65 years and older have the lowest health literacy level. Effect of limited health literacy. Limited literacy lead to poor health outcomes. So here we have poor health outcomes. Individuals with limited literacy skill are less knowledgeable about their health problem. Individuals with limited literacy have a higher hospitalization rate, more emergency department visits, so they will come to the emergency department even for small things, and it's this one, it will affect the cost and it's doctor time they will lose. So even the small things, they will come to the emergency department. Individuals with limited literacy have a higher health cost, less healthy behavior, and poorer health status. So action plan highlights 7 goals. So there is a 7 goal that will improve health literacy. First one, develop and disseminate health and safety information that is accurate, accessible, and actionable. So the second one, promote changes in the healthcare system that improve health information, communication, informed discussion making, and access to the health service. Third one, it's incorporate accurate standard uh, based and developmentally appropriate health and science information and curricula in child care as well as education through the university level. Fourth goal, it support and expand local effort to provide adult education, English language instructions, and uh, culturally and linguistically appropriate health information service in the community. Fifth goal, it's a build partnership, develop guidance, and change policies. So six, it's increase basic research and development, implementation, and evaluation of a practice and intervention to improve health literacy. So the last goal, it was increase dissemination and use of evidence-based health literacy practice and intervention. So the CDC, it's outlined the following common health literacy challenge facing many people. They are not familiar with the medical terms or how their body work. They have to interpret or calculate numbers or risk that could have health and safety consequences. So they are scared and confused when diagnosed with a serious illness. Also, they have health conditions that require high-level complicated self-care instructions. They are voting on a critical local issue affecting the community health and relying on unfamiliar technical information. Literacy relative to oral instructions. Today, it's very little attention has been paid on the role of oral communication in the assessment of illiteracy. Most health information can be provided verbally, and many people or clients prefer to learn face-to-face encounter, and it's easy. It's like يعني face to face, it's easy. They can ask, they can there is a reaction and you can see. But however, the oral instruction alone is not very successful method of teaching. Maybe they will forget, so need the information, written information, to back and read it again, refresh their information. So written information is better remembered and lead to better treatment adherence. Example of elements that affect readability and comprehension. Material variable. It should be legibility, for example, print size, spacing of the words. So organization and the flow of content, concept level also, it should be at the patient level, length of the text, sentence structures, level of vocabulary. Sure, we should not use the medical word. We should the simple that it's will be able patient to understand or client to understand. Relevance to the reader, medical terminology that, as I mentioned before, we will not use. Reader variables, health status, effect of illness, stresses, physical and mental energy, level of motivation, visual and auditory acuity, education level, background knowledge, ability to understand language of message. So this is all reader variables. Literacy related to computer instructions. The literacy issue has traditionally been examined from the standpoint of readability and comprehension of the printed material. Computer literacy has emerged as an increasingly popular concern and important dimension of the literacy issue. Educator sorry, and consumer are relying on computers as education tools, and potential of this technology is transforming the way healthcare information is accessed and shared. Clients who are well educated and career oriented are likely to own a computer, but those with a limited resource literacy skills and technology know-how are being left behind. Computer literacy, it's really in the overall client population must be addressed. Computer not only are used codify instructions message, but they also serves as a valuable tools for accessing a wide array of additional source of health information. As we know now, patient he can enter to the internet and search about his medical information that he's need. A trend associated with the literacy problems. So a rise in the number of immigrants, aging of our population, increasing complexity of information, and the increasing of technology, the added number of people living in poverty, changes in policy and funding for public education. Those who's at risk, those who are economically disadvantaged, older adults, immigrant, especially here the illegal one, those with English as a second language, high school dropouts, those who are employed, prisoners also, inner city and rural residents, those with poor health status resulting from chronic mental and physical problem, those on Medicaid. So literacy in literacy among older adults. As time goes on, a member of older population will be more educated and demand more service. Today, the illiteracy problem in the age is caused by a fact that not only did this individual have less education in the past, but their reading skills have also decreased over the time because of the disuse. If a person does not use a skill, here he or she loses that skill. Reading ability can deteriorate over the time if not sorry, if it's not uses regularly. Literacy among old adults. The vast majority of adult people have some degree of cognitive change and sensory impairment, such as vision or hearing loss. On the average, 28% of the people aged 65 and 38% of those older than 75 years of age have a serious hearing impairment. Women fare better than men in this regard. Along with this normal physiological change, many older adults suffer from chronic disease, and large number are taking prescribed medication. All of this condition can interfere, sure, with the ability to learn or can negative affect through process. So through this process, which contribute to high incidence of illiteracy in this population group. So there is important to assess element of verbal and non-verbal communication. So how we will assess as emotional tone of speech. gesture, also eye contact, touch, voice, volume, stance between the people, validation of information received or sent. So myth and truth about those whose struggles with literacy. Myth, they are intellectually slow learners or incapable of learning at all. They can be recognized by their appearance. The number of years of schooling completed correlated with their literacy skills. Most are foreign born, poor, and of ethnic or racial minority. Most will freely admit that they do not know how to read or do not understand. The truth here, many have average or above average intelligence, quotation. Appearance alone is an unreliable basis for judgment. Some very articulate will address people who have no visible signs of literacy disability. A grade level achievement does not correspond well to reading ability. The number of years of schooling completed overestimate reading level by 4 to 5 grade level. They come from very different backgrounds, so most try to hide their reading deficiency and will go to great length to avoid discovery, even when directly asked about their possible limitation. So assessment clues to look for. The nurse's educator should take note of the following clues that patient will literacy or low literacy may demonstrate. So, reacting to complex learning situation by withdrawal, complete of avoidance, or being repeatedly non-compliant. So using the excuse that they were too busy, too tired, too sick, or too sedated with the medication. Claiming that they just did not feel like to read, so I don't want to read now, I don't like, I'm sleepy, or the information paper or instruction that it was given to the relative or spouse, so to take home, or that they lost, maybe they will tell you I just lost, forget or broke their glasses, so they will just use excuse. Camouflaging their problem by surrounding themselves with books, magazine, and a newspaper to give the impression that they can read. So you can see your patient, he's handling magazine and he don't know how to read, just to show you I'm reading. Venting their inability by insisting on taking the information home to read, or having a family member or a friend with them when written information is presented. So asking you to read the information for them under the guise that their eyeglasses or it was bothersome, they lack interest, or they don't have energy to devote to task of learning. Maybe showing a nervousness because of feeling stressed by possibility of getting judged or having to confess to illiteracy. Action confused, taking out of the context, holding reading material upside down, or express thought that may seem totally irrelevant to the topic of conversation. So showing a great deal of frustration and restlessness. When attempting to read, often mouthing word aloud, focalization or silence, substituting a word they cannot decipher with meaningless word, pointing to word or uh, phrases on the page, or accessibility, facial signs of bewilderment or defeat. So they will just use all for excuse. Missing, you can see that also from missing his appointment. He's not coming in his appointment. Maybe not taking his medication as prescribed. He's failing to ask any question about information they is received. Yani when you're giving him information, he's not backing to ask you the question about the one you're teaching him. So it's all this one can to assess. So, impact of illiteracy on motivation and compliance. People with poor reading skill have a difficult analyzing instructions, assimilating and correlating new information, and formulating questions. They maybe do not ask any question because of concern that their questions will be regarded as incomprehensible or irrelevant. So frequently they do not even know what to ask, but they fear if they try, others will think of them as ignoring or lacking in intelligence. So, illiterate individuals have a difficulty synthesize information in a way that fits into their behavior patterns. If illiterate individuals are unable to comprehend a required behavior change or cannot understand why it is needed, they will disregard any health teaching. The person with limited literacy also may experience difficulties handling large amount of information and classifying it into categories. So older adult whose need to take several different medication at various time and different dosage maybe either become confused with the schedule or ignore the instructions. If asked to change their delay medication routine, you will have a great deal of retraining maybe need to convince them of the benefit of the new system or regime. Ethical, financial, and legal concern. Health education cannot be considered to have taken place if the written information that have been distributed to the client does not enhance their knowledge and the skill necessary for self-care. So unless patients are competent in reading and comprehending literate given to them, these instructional tools are useless as adjunct for health education. Material that are widely distributed but little or not all understood. It's not only health hazard of the client, but also its ethical, financial, and legal liability for health care providers. So test measure comprehension of printed education material. The first one, it's a closed procedure. In this procedure, we will just show how to work. This procedure, it's designed to every fifth word is a systemically delegate from portion of the text. The reader is asked to fill in the blank with the exact word replacement. 1 point or is scored for every missing word guessed correctly by the reader. So when he is answered, we will give him 1 point. The final close score is the total number of blank fill that he is answered correctly by the reader. So listening test, and this test, it's the listening test is a good approach to determine what a low literate person understand and remember when listening to oral instructions. So the test here design, it's the listening test is to select a passage from instructional material that takes about 3 minutes only, not more, to read aloud, and is written at approximately the 5th grade level. So formulate 5 to 10 short questions relevant to the content that you read by selecting key point on the text. So you will take the key point, the important word. Read the passage and or paragraph to the person at the normal rate. Ask the listener the question orally and record the answer. So here simplify the readability of printed education material. Decide what the client should do. Decide what the client should do or no. Choose information that's relevant and needed by the client achieve the behavior objective. Select other media to supplement to written information, such as maybe picture, demonstration model, use CD or DVD. Organize topic into chunk that is follow a logical sequence. Determine the preferred reading level of the material. So teaching strategy to promote health literacy. Establish a trust relationship before beginning to teaching learning process. Use the smallest amount of information possible to accomplish the predetermined behavior object. Also make a point of information as a fifth and splits as a possible. Teach step by step, yani one step at a time. Use multiple teaching methods and instruction tools require fewer literacy skills. Allow patient the chance to restate information in their own words and to demonstrate any procedure begin taught already. So keep motivation high, build in coordinate of the procedure, use repetition to reinforce informations. So here our conclusion. Nurses in the role of educator serves as a communicator and interpreter of health information. Nurses must always be alert to the potential limited capacity of their client to grasp the meaning of written and oral instruction. A nurse's educator need to know how to identify client with literacy problem, assess their need, and choose appropriate intervention that is create as a supportive environment directed toward helping those with poor reading and comprehension skill to better and more safely care for themselves. And thank you. This is my reference. It was from book Nurses as Educator. You will see the link of our book and the link of this lectures uh, under the video inshallah. And thank you for listening.